I'm excited to be here to talk to you all about how to take care of your baby after you bring the baby home from the hospital. I'm hopeful that you will take away some very helpful tips after this presentation, and as new parents, you'll be very confident of dealing with your newborn baby. So opening up the talk, I would like to say welcome to Parenthood. So once you have a newborn, you're all parents, so welcome to Parenthood. As a parent myself, I want to assure you that this is an amazing journey. As the slide represents, there's a lot of surprises along the way, but I want you to remember that this baby is a unique gift for you, and I want you to enjoy this ride as you go. So opening up the talk, I want to throw in a few points about car seat. I have seen more than a couple of times after I discharged the baby from the hospital, some frantic new parents trying to fit the car seat in the parking lot and struggling with it. So I decided to bring this up. So if you guys are still, if there are some people out there still procrastinating about fixing that car seat, now's the time to do it if you've still not had your baby. So hopefully you still have that time to fix that car seat in. Babies definitely don't read the book. They could decide to come earlier, so go ahead and fix that car seat in ahead of time. There are some good resources to look at. One is a website pointed out there. You could take a look at that. That's a helpful resource to get all the help you need on fixing car seats. So definitely have the car seat ready to go before you drive to the hospital, okay? So let's move on and try to look or glimpse into how the first 24 hours are going to be after you bring your newborn home. So for this, my most helpful tip would be maintain status quo, which is that's going to be your mantra. Basically, your baby has been checked by professionals, by pediatricians. They've ensured that your baby is totally normal. They've done multiple tests on your baby, and they would have checked him off to go home. So your baby should be absolutely doing fine that first 24 hours. So there's no need to panic. All you need to do is just continue what you were doing in the hospital. Continue to feed your baby every couple of hours if you're breastfeeding, and continue to log those voids and stools. It's important to log them because you will be sleep deprived and you may not be able to recall if the baby actually had a wet or a dirty diaper. So go ahead and document it in the log. And you want to make sure that you are actually sleeping and getting some rest when the baby is sleeping as well. Now, with one important point to remember with newborns is with feedings, apart from feeding every 2 to 3 hours in a breastfed baby, they could also sometimes cluster their feeds in that first 24 hours to that first week. So they could feed a little bit more frequently at certain times of the day. And that's a good sign. So the other thing is the number of voids and stools. So the first day we want to see 1 void, and the second day we want to see 2, and the third day we want to see 3. Similarly with the dirty diapers, the first day you want to get a count of 1 dirty diaper, the second day 2, and the third day about 3 dirty diapers. So if you're logging in so many, then your checklist is good and your first 24 hours should be pretty smooth. So definitely try to get in some rest. Definitely try to minimize those extra visitors. You want to rest with your baby that first 24 hours. And of course, the most important thing is to make that appointment with your pediatrician. Hopefully you've picked your pediatricians in the, before delivery. That's the best way to do it. If not, you can still pick a pediatrician right after you deliver the baby. And before discharge, make sure you have set up that appointment with the pediatrician. Okay, so that's first 24 hours. It should be pretty simple. Just maintain status quo and you should do good that first 24 hours, okay? Moving on. Now, let's talk about the first pediatrician appointment. So the first pediatrician appointment is usually within 2 to 3 days after discharge. Now, as pediatricians, we like to see babies back at specific, timelines, and we see them back usually after that first 2 to 3 day visit. We see them back at 2 weeks, then again at 2 months, 4 months, and 6 months. So that's the normal timeline. So what happens at that first pediatrician visit? We weigh the baby. So when we weigh the baby may have lost a little bit of weight, and that's very normal. Babies can lose up to 10% of body weight in that first week. Some babies may take up to 10 days or even 2 weeks to regain all that birth weight back. And this has to do with a lot of shift in fluids, and this is all very normal. So do not panic when you see that little bit of loss of weight in your baby when you go into that first pediatrician appointment. The second thing we as pediatricians look at that first visit would be jaundice. Jaundice is a term we use to describe the yellowness or the yellow skin in babies. Again, this is a very normal phenomenon in a newborn. We check this because babies' livers are very immature and they cannot process the pigment very easily. So it spills over into their blood. So what happens if it spills over into their blood? It can go into their brain, and that's the concern. So the first 3 days of babies' lives, they don't have a barrier separating the blood from the brain. So the excess pigment in the blood can go over into the brain and cause problems. And that's the reason why we follow jaundice. And in our offices, we're usually able to check this very easily on newborn babies. We're able to just scan it on their skin. And if that's not too high, we let you guys go home. Sometimes, occasionally, if that jaundice is high, then we have to do a blood test. And in our office, we're able to draw that in our office, and we follow that up. And intervention for jaundice, if it is high, is very simple. We just put the babies under a special blue light, and that takes care of the pigment. It just gets rid of the pigment in their poo and pee diapers. Most often we're able to send you home with the special blue light. In most of our Hoag offices, we have the facility to do that. So we send you home with that, and we educate you on how to use it. And it's a very simple process, and babies get better in a day or two. And we rarely need to hospitalize babies for this. So jaundice is a simple thing, and we take care of it in our offices. The third thing we look for is the baby feeding fine? So as a pediatrician, I myself like to look at an actual, feeding session for the baby if possible. Either, a nursing, or if the baby is taking formula, either one of those, I would like to actually look and ensure that the baby is able to feed well. Again, we look at all those logs that you maintain at home to make sure that the baby is getting about 9 to 12 feeds a day, and he's getting adequate, diapers, dirty and wet diapers. The most fun part about the pediatrician appointments would be the anticipatory guidance that we talked to you guys about. It is how your baby is going to grow the following weeks. We discuss about the growth chart. We look at their weight and height as they grow. We talk to you about safety at home and outside. And all these is covered at every visit through the anticipatory guidance at your pediatrician's office. So make sure you get that pediatric appointment before discharge, and make sure you pay attention to all these points when you see your pediatrician. Moving along, let's talk about the first 2 weeks. I thought there's a really cool picture there. That's how babies feel for 2 weeks after they're born. So they're trying to transition from the womb to the world. So they're trying to get used to all the sounds and the noise and the light and the touch and everything else. So mostly they feed, they bond with the caregivers, and they have dirty and wet diapers. There are certain physical changes that you can expect in that first 2 weeks after you take your baby home. So some babies, due to the birthing process, when they're born, they could have a little swelling or a cone-shaped swelling on the head that usually disappears in the first week. They could have a little bit of sticky eyes develop, as the week progresses, and this is very normal. This is due to a blocked tear duct and usually resolves on its own. You could see some tiny bumps and rashes in that first, week or two after you take your baby home, and this is very normal too. Usually it disappears in 1 or 2 weeks. The umbilical cord tends to separate in that first week or two, and that's a very natural process. There's a lot of swelling after your baby is born in the face and around the eye area, and all that disappears too in that first week or so. So, so hold your baby a lot in those first 2 weeks, cuddle with them, and try to relax and try to get them transition from that womb to the world, all right? Moving on, in the first 2 weeks, as new parents, this is going to be a new experience to you. You will have to, you will listen a lot to your baby cry. And this can be a little overwhelming in the beginning as new parents, but it's a learning process and we all cope with it and we'll learn to deal with it. So babies cry to communicate. Babies can cry up to 3 hours in that first 2 to 4 weeks per day. Per day they can cry up to 3 hours in the first couple of weeks. And that's very normal. So a couple of things to look for in a crying baby. In that first couple of weeks, you want to make sure that your baby is not hungry. So when they're crying, you want to try to either nurse them or give them a bottle and see if that calms them down. And sometimes they may cry if they have a dirty diaper. So definitely take a look, make sure they have a clean diaper. Sometimes they just want to be reassured. They just want to be held close. They want to be cuddled, and that's what you want to do. You just want to pick them up, hold them close to you, sing to them, try to see if they calm down. Most of the times, these techniques work in that first 2 weeks, and you can pretty much calm your baby down. A little bit after 2 weeks, you could see a little bit more crying when they don't calm down to these techniques. We usually resort to what we call the 5 S's. So it has to do with 5 techniques that start with the word S. So the first technique is swaddling. This is a proven technique that helps calm babies down. I usually just recommend using like a 42-inch blanket, and I recommend a thin blanket. Just go ahead and gently, firmly wrap your baby's arm along the side of the body. You want to leave the hip area a little loose and do a firm wrap and try to gently rock them back and forth, and they usually settle down. If that doesn't work, you go to the second S, which is you can roll them a little bit onto their stomach to a side sleeping position. Remember, we don't recommend baby sleeping on the side. We always recommend that baby sleep on their back to prevent SIDS. But when they're crying a lot, you could try this technique of just rolling them to the side or holding them up on your shoulder, like the picture shown there, and try to see if they calm down with that technique. If that doesn't work, you can use the shushing sound. Babies are used to a lot of sound, loud noise in the womb. Actually, it's almost like a vacuum cleaner. That's what we think. So you can use a loud shushing, noise really close to their ear when you're holding them up over your shoulder, and use that in continuous succession to see if that helps calm them down. Once they start to calm down, you can start, reducing that shushing noise. Or these days, a lot of parents even use the white noise, and that seems to work well too. So if that doesn't work, then you can resort to a pacifier, or, the sucking reflex usually calms them down from crying. I don't recommend a pacifier that first 2 to 3 weeks till you have established breastfeeding really well. So you could use your finger and try to calm them down with sucking, or you can just breastfeed them and see if they calm down with that. There's one more S that I forgot, and that's swinging. So you can even swing your baby, not shake your baby. Remember, babies crying can get you frustrated. Try to stay calm through it. We don't want you shaking your baby. Okay, so try to just swing the baby. We usually recommend a swift, quick swinging for a few minutes, like, to and fro, quick swinging for about an inch up and down, really quick. And that's the motion they're used to in the womb, so that usually calms them down. The gentle rocking is not going to calm down a really crying and agitated baby. So you want to do that in swift, quick motions for a few seconds, and that usually calms them down. All right, so hopefully with these tips, you feel more confident of dealing with your crying baby. in those first couple of weeks. All right, so let's move on. So nursing and feeding, this is a very important topic that you want to educate yourself about, because right after having your baby, this is one of the issues that you may run into. So the AAP and all pediatricians, we recommend breastfeeding is the best nutrition for your baby. It has all the important stuff that the baby's brain and body needs to grow. So definitely try to breastfeed. If there are some barriers to breastfeeding and you're unable to breastfeed, there's always formula, and that's fine. Definitely talk to your pediatrician before taking that step. So with breastfeeding and even feeding, you want to start this as soon as the baby is born. So when the baby is born, that first hour is called the golden hour. That's when, even in the hospital, they have the baby do skin to skin on the mommy, and that's when they are encouraged to nurse and breastfeed. And you definitely want to start breastfeeding within that first hour after birth. And definitely lean on all professional support that you can get at the hospital. You have educated nurses, very experienced nurses, and you have lactation consultants in the hospital. Definitely ask for help and take all the support that you can get in the hospital. Familiarize yourself with all the different positions of breastfeeding and get as comfortable as possible with this process before you take the baby home. And I've put up the breastfeeding and the baby line a phone number for you for referral. That's with Hoag, so you can contact them even after discharge to get help regarding breastfeeding and nursing. I do want to point out that definitely don't overwhelm yourself with Google and internet and trying to get information from all these sources and exhaust yourself with it. We definitely have proven resources, very educated and efficient resources to help you out. So I would urge you to use these resources than just going on internet and Google. So with the breastfeeding baby, after you take the baby home, they will feed about 9 to 12 times. Breastfeeding babies will feed a little bit more frequently than formula-fed babies. Breastfeeding babies feed every hour and a half to 2. Formula-fed babies may feed every 2 to 3 hours that first week. So to have an effective breastfeeding strategy, I recommend that it's better to leave the baby in your room. I don't recommend co-sleeping, but definitely in the same room as you are. So in a bassinet or a crib, whatever works for you guys, so you have easy access to the baby every hour and a half to 2 and you don't get exhausted with all the feeding sessions. You also want to get enough rest. You want to sleep when the baby is sleeping to be able to produce that breast milk. Your milk, in the beginning, the first 2 days, you produce just enough for the baby. So a lot of moms are anxious about, am I producing enough for the baby? I want to reassure you that you don't need to worry. You will be making as much as the baby needs, and your breast milk production will increase as the baby's need increases. So on day 1, you produce just enough for the size of a stomach of a 1-day-old baby. So by day 3, you will have enough breast milk for a 3-day-old baby. So you will notice by day 3, you will be producing more milk and your baby will be more satisfied between feeds. And he's going to start giving you more dirty diapers, which are going to turn yellow, and you're going to not feel as exhausted as you were the first couple of days. So hang in there and try to get all the support you need to have a successful, be successful at breastfeeding your baby. And if you have any questions, you definitely want to reach out to your pediatrician or the lactation line to help you out on these resources. Also, you can also start pumping after a few days or even a week if that's possible. You can take a break and your partner or spouse can take over that feeding session at nighttime just to give you a break so you're not overexhausted from all that feeding. There's one recommendation that I strongly make is not to introduce a pacifier that first couple of weeks till you've established breastfeeding completely. And after that, it's up to you, and you can talk to your pediatrician and see what the best option would be after 2 weeks for introduction of pacifier. Okay, so hopefully with these, you can be assured to have successful breastfeeding with your baby. Moving on. So moving on, after the first 2 weeks, the most important thing we need to learn is about babies and their sleep. So for first 2 weeks, we kind of focused on feeding, changing, holding them. And then after 2 weeks, it hits us that we're a little more exhausted. We need more sleep. Why is my baby not sleeping? So these are the things that start coming into play. So for this, we need to understand some of the sleeping behavior or baby behavior to just understand how do we deal with this. So babies usually sleep 16 to 18 hours a day. Wow, that's amazing. But do they sleep all this in a single stretch? They don't. They don't sleep 16 to 18 hours in a single stretch. They usually break it up in small sessions of 2 to 3 hours. That's because they have to frequently get up to have a meal. They need to either nurse or take a bottle, so they kind of keep waking up. So that's why their sleep is infrequent and it's not a long stretch. Babies also are mixed up. They just don't have any clue about day and night. So their brain is just not used to the sunlight, and they don't know when it's day or night, so they're just all mixed up. So that being said, how do we approach this in that first 2 weeks? In that first 2 weeks, be prepared. You're not going to get as much rest. So you just want to take every chance you get to nap. Try to take a break or try to sleep when your baby is sleeping. If you have visitors, I just tell, put aside your social grace, try to take a nap when they're taking care of your baby. Try to split up duties with your partner. Try to have them, feed the baby at nighttime if possible, so you can get a little nap. So after about 2 to 3 months is when babies possibly will start showing a definitive pattern of sleeping and waking and feeding. So that's when you want to start incorporating a more strategic, ways of implementing sleep time and feeding time, and start putting them on a schedule and promote healthy sleeping habits. So I usually discourage co-sleeping because that does not promote a baby sleeping well, or neither can the parent who's taking care of the baby. You can have the baby in the same room, but definitely have the baby in a crib, or you can have them in a bassinet till they get a little bigger. Of course, follow safe sleeping precautions. Make sure you don't have too many stuffed toys, too many, thick pillows, or, stuff that can suffocate your little baby in the crib or the bassinet. Eventually, by about 3 to 4 months, you will notice a definite sleep pattern emerge. There's one more thing I want to bring up as a tip, that you can start exposing your baby to a little bit of sunlight early on, and this usually regulates melatonin production. This actually helps them realize, or their brain to, develop and realize this is day and night, and hopefully that will set in a more schedule pattern of sleep in babies. You also want to bring in a good sleep time routine after that 2-month mark, so they develop good sleep habits. You want to start, dimming the lights in their room at nighttime. I would also recommend not overstimulating them prior to bedtime routines. Try not to expose them to too much bright LED lighting, especially at nighttime. But during the daytime, you want them to get used to whatever happens in your house. So let them get exposed to all the noise, the hustle bustle, whatever is going on in your house during the daytime. So just try to expose them to daytime routines and nighttime routines, just like you do to yourself. So eventually that will stimulate the brain to adapt to day-night shifts. And that will help promote healthy sleeping habits in your baby. All right. Moving on. So daddyhood, I thought this was important to bring up. So big shout out to all the dads and the dads to be. If you're feeling this way, that in the picture. It's not uncommon. I think most dads would agree to this. You know, most moms, all moms have the baby in their womb, so they are already familiar with a lot of things going on inside them. And once the baby is born, it's very easy to adapt and take on that lead role of, you know, baby care and taking care of that baby as soon as the baby is born. It's a little bit different for dads in terms that they have to bond with the baby after the baby is born. So it's not unusual to go through a little bit of angst initially as to, you know, to expect some uncertainty. But once your baby is born, you will be fine. So the best way to empower yourself as to-be dads or new dads would be to actually get some knowledge about these things. So different people learn in different ways. Everybody has a different style of learning, so you can get information by reading a book or taking a little class, or you can talk to a bunch of other dads who have had this experience and who can help you out. But definitely try to step in early into that shoe of, you know, taking on that newborn care as early as possible and not miss out on that experience. A lot of times when I walk into that room, you know, in the hospital to see that newborn baby, and I see that perfect swaddle, and there's that dad who's beaming and he's so happy. I can sense it. He's so happy that he did that perfect swaddle. And my heart is so warm when I look at that because he's having that perfect experience of daddyhood. So empower yourself, get the knowledge, take a class, jump in right away in, you know, taking care of that baby, soothing techniques, just changing diapers, even doing a feeding during nighttime. So jump in there and enjoy that experience, okay? So there was one last thing that I wanted to touch on, the emotional health as parents. This is very important to actually go through that experience of parenthood. So if you're emotionally healthy, you will definitely enjoy that experience of being a parent. So definitely pay attention to it. The whole of pregnancy and birthing process is a lot on the whole family, just not the woman, but the whole family. So for the woman, you actually have a lot of hormonal changes. So respect that birthing process. You have so many changes that let those emotions run through you the first 2 weeks. Ask for help if you need it. Talk to your spouse about it. Lean on family and friends. Have them, you know, come over, take care of the baby, or bring in food, or whatever it takes. Take breaks. Take some time off for yourself. And try to talk to your physician if you feel you're overwhelmed. If you're already dealing with mental health issues prior to having a baby, then it's even more important to talk to your provider if you're not able to cope with that stress postpartum. And definitely keep in and get help if you think you need medical intervention in terms of emotional health. So on that note, I am going to open it up for questions. So just keep calm, and parenting is an enjoyable experience if you get on the ride. So here are some questions, so I'm going to go over them in order. First question here, what do you do if the baby loses too much weight? So up to 10% weight loss in that first week to 2 weeks is very normal. If the baby loses too much weight, which is beyond that 10%, is when we as pediatricians will recommend certain techniques. We may tell you to pump, or what we call double pumping. Sometimes we have you feed the baby and then pump, and then we have you supplement that express breast milk through a bottle or an SNS syringe. That usually, you know, helps them gain weight. On very rare occasions, if we notice that there are barriers to breastfeeding, if there are issues with supply and demand, then occasionally we do recommend formula for supplementing, but that's our last resort. But in the very beginning, we just recommend trying to, you know, pump breast milk and try to supplement that apart from just nursing. And of course, if it's beyond, if the weight doesn't go up after we do these techniques, then we'll have to actually look into, is there actually something wrong with your baby that we need to look into further, okay? But most babies gain their birth weight close to 2 weeks. Even if they lose beyond 10% of their birth weight, they definitely gain it back by the time they're 2 weeks old. All right. So is there an app suggested to log the voids and stools? Usually when you are in the hospital, you are given a pink sheet that I've seen at the Hoag facilities to just check off the voids and stools. I would just suggest to use this. This is the most convenient way, because when you're really tired and exhausted, all you have to do is look at that sheet and just put a tick mark in there. And it actually has a 24-hour timeline. So you just tick off against that particular time. To me, that seems to be the easiest way to a tired parent. There could be apps, but I think when you're really sleep deprived and exhausted, it may be really hard to use these apps. That is my suggestion, just to use whatever that log sheet that the hospital provides you. At what age can you start using a jogger stroller? That's a great question. I would say after about 2 months of age, just when your baby's a little stronger in the neck, you could start using a jogger stroller. I don't see any reason to use it before that, but after 2 months, it should be perfectly fine, okay? All right, one more question. Let's see here. Should you set an alarm to wake up the baby to breastfeed in the middle of the night? That's an excellent question. So I get this question a lot. So in those first few days, you know, that first 3 to 4 days when your milk is just starting to come in, and we want to make sure that the baby is getting enough milk, we recommend that you wake up that baby every 2 to 3 hours so they're topped off or they're getting enough. By the end of the week, most moms have enough breast milk and their production is ramped up and breastfeeding is established. So at that point, we usually say that if they are going longer stretches with the sleep, you can let them sleep. Usually babies, even at 1 to 2 weeks of age, they will not go longer than about 4 hours. So you really don't need to wake them up after that 10-day mark. Once your breastfeeding is completely established, you don't need to wake them up. They can start stretching out their sleeping time a little bit. Okay? All right, one more question. Should I bring diapers to the hospital? That's an excellent question. At our Hoag hospitals, no, you don't need to. We provide you with diapers and wipes and all that good stuff. Okay, so you really don't have to bring in diapers. All right, so I think with that note, we're gonna end this, and I'm just gonna leave you my contact information. Hope you're able to take away some important points from this presentation. Have a good night, everybody. Take care. Bye-bye.